Hello everyone. I'm going to assess one of the students' role play conversations, and this is the role play card. We have got two role play cards. One is for the interlocutor who is going to act as a patient. This is the patient setting. The patient is in the hospital accident and emergency department. The patient has just fallen down the stairs home and think has been broken one of the toes. It's black, swollen, and at a strange angle. The patient cannot put weight on it or wear a shoe. So the patient has come to the hospital for treatment. The emergency department is very busy. Okay, this is the situation of the patient as well as the hospital setting. The task is, so the patient is going to tell the nurse that he or she fell down the stairs and heard and felt her toe crack, and the patient cannot bear the weight or stand on ill, and is unable to wear a shoe as well. You need to the patient is going to ask whether it is broken or not, and the patient is also going to ask for an x-ray because the patient may have been waiting for a long time, and the patient is going to reluctantly agree to the standard treatment and ask how quickly it will heal. And then the patient is also going to ask what to do if you are still in pain after a few weeks. I would like to give you one clue for everyone watching this video. Please be mindful that the interlocutor card is not going to be visible for you, and the interlocutor's role play card may have more information than the one you have got. And please note that most of the questions are going to be asked by the interlocutor, and you are going to answer the interlocutor's question from your occupation's point of view. Let's say if you're a nurse, you're going to answer the patient's question from the nurse's point of view and within the nurse's scope. All right, so mostly it's going to be like a Q&A session. So the patient is going to ask you the questions and you are going to give them the answers for most of the time. And see this one, ask and then ask as well, isn't it? So most of the bullet points are going to be the questions that are going to be raised by the interlocutor to the healthcare professional, whether it is a nurse or a doctor or a physiotherapist or so on. Okay, now let's read the nurse's role play card, and the nurse's role play card is going to be this. It's going to be the same thing. The patient has come to the emergency department because he or she thinks he or she has broken a toe. One of the main reasons why many students fail is that in the actual role play conversations, they never think from the patient's perspective. All right. So what we think is only from the nurse's point of view or from the doctor's point of view or from a physiotherapist's point of view. In short, the healthcare professionals should think from the patient's perspective as well. You have to understand that even if they haven't broken their toe, you have to firstly acknowledge their concern, and then you have to provide assurance to them so that they will feel more what I can say motivated. Okay, and they will be able to share with you all the information you are asking. All right, okay, that's what I would like to highlight here. Okay, it's a very busy weekend night, and the patient has been waiting for some time. Okay, that's what you're going to do. So the task, when you look at this tasks, you have got more tasks than the patient, isn't it? Sometimes it can also happen the other way around. Okay, but look at this one, find out what happened to the patient's foot and their mobility or pain. So when you say find out, you need to always put more emphasis on all the verbs that are going to be in the bullet points. I mean, find out means you just need to ask. How do we find out? By asking the questions, isn't it? And what is by explain, which means you need to elaborate, you need to provide more information, you need to provide details on that, isn't it? And then look at this one again, explain. You have to give descriptions, you have to describe, you have to explain, you have to elaborate. All right, tell the patient. Okay, it's going to be, you have to share this information. And that reassure means you have to ensure that the patient's concerns are addressed and acknowledged and they are happy to proceed with. Okay, that's how you need to provide. I mean, you need to create a positive vibe in the patient's mind. Okay, that's what you're going to do. And let's see, if you are able to address all the bullet points in your role play conversation. Let's start the assessment with. Let's start.
Hello, good evening.
Good evening.
My name is Sakshi and I'm one of the registered nurses in this emergency department. I apologize that you have to wait so long. Unfortunately, emergency department is extremely busy today due to the weekend. But you don't need to worry at all. I'm here to assist you. May I know the reason behind your visit?
That's good. It's a great way to start because she was able to showcase care towards the patient and she apologized for the inconvenience caused to the patient. One of the main assessment criteria for your OET speaking is that you have to apologize to the patient whenever is required. You have to thank the patient. You have to say sorry to them if there are some issues. So she was able to kickstart the conversation really very well. Let's continue. And she didn't commit any background noises or false starts which she used to commit in the previous role play, so it is a welcome change. Let's continue.
Actually, nurse, today at my home, I fell down, and after that, I had some pain in my right toe. And I
Okay.
don't know why, but it's black and swollen. And it's just very painful. Whenever I'm trying to put some weight on it, it's just like it's paining a lot, and I'm unable to wear my shoes.
One of the good things regarding the speaking role play conversation is that the nurse was able to wait patiently when the interlocutor has been sharing the concerns, which is one of the good things. To be a good speaker you need to be a good listener, and she has been doing a fantastic job so far. Let's continue.
I'm really sorry to hear that. I know.
Okay, unfortunately, she said, and then I'm really sorry to hear that. So, this is not good. When you start speaking a sentence, you have to start and finish. You don't need to come back to the beginning of a sentence and then start once again. This is what we call false starts. So, false starts need to be reduced, and in the best case, it's better to remove that completely. I mean, you shouldn't commit any false starts or background noises in your role play conversation because it's going to decrease your score. Let's continue.
It must be very painful for you, but don't be too stressed.
Mhm.
This can be well managed with certain treatment, and I'm here to help you. May I know your name and age for my documentation purpose?
Yes, my name is Ayush, and I'm 24 years old.
Okay, Mr. Ayush. May I know what exactly happened?
Yeah, actually, I was coming down from the stairs, and
Okay.
suddenly my leg slipped and I fell. But I think the whole impact came on the toe, and as I already told you, it's now black,
Mm-hmm.
swollen, and I'm having so much pain.
Yes. Yes. Okay, Mr. Ayush. I understand your concern. May I know if you have any problem with mobility?
Yeah, actually, I'm unable to like mobilize my toe also. Like it's at a strange angle now. Are you able to understand like what
Yes.
I'm saying?
Yes.
Thank you,
Yes.
nurse.
Yes, Mr. Ayush. Can you
You don't need to say yes, Mr. Ayush, isn't it? Yes, Mr. Ayush. You can say once only. Again, it is a kind of false start. So false starts need to be avoided. False starts need to be avoided, please.
I understand. Thank you.
please rate your pain on a pain scale where 0 is the least pain and 10 is the worst pain?
Surely it's no less than 8. I mean, it's very painful.
Okay, I'm really sorry to hear that, Mr. Ayush. It must be really painful to cope up with the situation. I can understand that.
Cope up with the situation. That is unfortunately wrong. You can't say cope up with, you have to say cope with. That's it. We don't need to use cope up with. All right. So cope with. So it's really hard for you to cope with the situation. That's good. You don't need to say it's really hard for you to cope up with the situation. That doesn't make sense. Okay. Please be mindful about that.
Can I examine your toe in order to get a better understanding of your situation?
Nurse, you can do me a favor.
It's great to ask for the consent from the patient, and she has been doing exactly the same thing. I'm so happy regarding the way you are dealing with your patient. Let's continue.
And take the like take my X-ray. I don't want you to take my to do some these things. Just take the X-ray. I mean, I'm afraid I think I have broken my toe and I need to be sure about it. Like, please.
Yes, Mr. Ayush, I understand your concern, but let me first examine your toe. Then we will decide that whether it needs an X-ray or not. Okay?
Perfect. The way you are sharing the instructions is amazing. I'm so happy that you have made a very good impact on your speaking after hearing my feedback on your previous role play conversation. So, connectivity is amazing. You are able to say what you would like to do. So, connectivity is amazing. It's really good. Let's continue with the next one.
Nurse, I mean, it's just wasting time. Let's just go to the radiology department and get it x-rayed. I mean, we are just wasting time. You're just wasting my time. Understand this.
Mr. Ayush, you no need to be overly concerned about it. As I already told you that today emergency department is very busy, and with that our radiology department is also busy because of weekend. So first let me examine your toe, and for an injured toe and for a broken toe we have the same treatment modality. So you don't need to worry about this. Okay?
You no need to worry about this. Unfortunately, this is wrong. You should say you don't need to worry about that. You can't say you no need to worry about it. Unfortunately, this is wrong. So you should say you don't need to worry about that. You don't need to worry about that. Okay, that's going to be more appropriate. All right, let's continue with the next one.
Okay, nurse, go ahead.
Okay. Yes, Mr. Ayush. So based on
One of the recommendations that I have got for you is that you don't need to take so much time to examine a toe. I mean, just look at it quickly and then you can explain that. You don't need to take so much gap of, let's say, more than 2 seconds or 3 seconds. Okay.
my examination, I see that your toe is badly injured.
Oh,
Um, well, I cannot confirm that it is broken, but
oh,
yes, as I told you, the treatment procedure for the badly injured and broken toe is same. So
all
it
right.
can be dressed properly and taped to the adjacent toe so that you will have a faster wound healing. I hope you are understanding me.
Okay, so how quickly will it heal, nurse?
It will take approximately 6 weeks to heal completely if you will take care of it properly.
All right. And nurse,
And
I'm also having pain. Like you have done this first aid, but I really require some medicines for this pain.
yes, Mr. Rajesh, I would like to suggest you few more measures to get a faster uh, recovery. Is it okay with you?
Okay. The way you are pronouncing, this phrase is not appropriate. We need to pronounce it as measures, but the way you pronounced was like measures, right? Isn't it? So pronounced incorrectly as measures, something similar to this. Okay, this is not good. It should be measures. Sha. It's going to be m. So the way we are going to say is this. Okay, instead of measures. Okay, this is how you need to pronounce measures. Okay. All right, let's continue.
Yes, ma'am, please.
Yes. So firstly, put an ice pack on your injured toe at least every 20 minutes for the first few days. And secondly, please elevate your toe, uh, whole foot above the hurt level by placing some pillows to reduce its pain and swelling. And finally, it's highly important to take sufficient rest to get a complete recovery. Okay.
It's great. Okay, so the way you are sharing the information makes sense. You are able to provide good explanation in relation to the treatment procedure as well as the way that needs to be taken care of in an ongoing basis. Yeah, so I'm quite happy with that.
Very happy.
But if the pain still persists after these few weeks, then what should I do?
Yes, Mr. Ayush, I can sense your worries.
Okay, unfortunately, you said I can sense your worries. Unfortunately, this one doesn't look good because you have committed false starts. Yes, false starts need to be avoided, please. But the good thing is that you have reduced the frequency of your false starts when compared with that of your previous role play conversation, and I'm so happy about that.
Uh, you will be provided with some.
You don't need to say you will be provided. This is again false starts. False starts need to be avoided, please.
Pain medications such as ibuprofen and paracetamol so that you will definitely get a better relief from your pain. And in addition, I would like to let you know that if you do not see any improvement even after.
Unfortunately, 5 minutes are already over. It's highly recommended for you to manage your time very well. If you get so many bullet points in your role play card, it's better to provide the explanation in one go itself in a clear manner so that the interlocutor won't ask you many questions again and again. But let me give you the assessment before I can share with you the score. As far as the assessment is concerned, grammar has been improved tremendously. I'm very happy with the way that you have improved your grammar. So you were able to speak most of the sentences without any grammatical mistakes. However, you have committed some false starts and background noises, but they are minimal. I'm quite happy with that because false starts and background noises were committed in some instances. Apart from that, I'm quite happy with your pronunciation. So your pronunciation is all right, and there is one phrase where you have mispronounced as well. For example, measures was mispronounced by measures. Okay, so pronunciation is all right. It's not that bad except in one circumstance. Okay, I'm quite happy with that. It's not that bad, it's really good. Vocabulary is amazing as well. I'm quite happy with the vocabulary. You were able to use more formal vocabularies. You were able to use reassuring phrases and things like that, which is really good. Use of a range of sentence structures is awesome. Yeah, I'm so happy with this one as well. I'm quite satisfied with the way you have been sharing the information as well. Okay, so sharing the information with the patient and asking for the information have been appropriate. So it's really good. You were able to politely ask the information. You were able to share the information in an effective manner. So I'm quite happy with that. One of the things that you have to be a bit mindful about is the time management. So time management wasn't good enough because you have dragged the conversation for 6 minutes. So it was time management wasn't good. You need to finish the whole role play within 5 minutes, please. But you have taken, I think, 5 minutes and 50 seconds and so on, which could have been avoided. Connectivity is at its best. I'm so happy with this one as well. You were able to speak at the right pace. Your speech rate was amazing. It was appropriate and people were easily able to understand the information that you're sharing, which is really great. You were able to demonstrate exceptional clinical communication skills. I'm quite happy with this one as well. It's really good. You have transformed the skills really very well, and I'm so astonished in regards to your speaking in this role play conversation. Everything else looks good. I'm quite happy with that. For this role play, apart from the time management, I'm fully satisfied with this role play conversation, and I'm happy to provide you at the maximum of 350 out of 500 for this role play conversation. Well done for achieving B grade for your first role play conversation. Now I'm pretty sure you should be able to get more than that if you can reduce all these mistakes and manage your time in your next role play. Congratulations on achieving B grade in this role play conversation.
Congratulations. Good job.